For some reason, I can't see any of you. All right, so we'll probably have to. One second, let me see if I can. Hold on. There we go. There we go. Okay, I can't see any of you, but is that okay? If there's anything, if anybody wants to ask me anything, just unmute yourself. I can try and get out of it, which I don't seem to at the moment. Okay, is that okay?
Yes, Doctor.
Perfect. So, talking about CVs, just a little bit about myself. My name is Dr. Ashitha Nair. I'm currently a GP trainee in my last year of training at the East of England Deanery. I started working in the NHS in 2019, I believe, and it's going to be almost 5 years next year since I've started working in the NHS, and it's taught me quite a bit. It's taught me a lot of important things, and one of the most important things that I've learned from, in my time in the NHS being how to get a good CV done and why it's important. I think in terms of just talking about why CV is important, when you are coming from any other country that does not hold value to the CV a lot, then that's when problems happen when you're trying to move countries. So what I'm trying to do is, kind of just make sure that barrier is no longer there and you have an understanding of how to get this CV done properly. So as soon as I hear a CV, this is basically my face. I'm just like, I have no idea what to do. And I presume most of medical students around the world also will basically be like this. And you'll put in a lot of things that probably will not be important, but you think it is, and you want to just fill up your CV, hence you put it. And there are very high chances of rejecting your CV at that point of time. So what I'm going to do is I'm going to just quickly go through what the CV needs, different parts of the CV and things like that. So bear with me. So why is a portfolio or CV important? Now, in the UK or the US, your professional development and your accolades are assessed by your portfolio or your CV. It's just called different names everywhere. It's probably not called a CV here. We basically say it as a portfolio. So it's, when you have models, they show you your portfolio, isn't it? They're just like, this is my work, this is who I am, have a look at it. So that's a similar things with medicals as well, where you have to have a record of your achievements. It is evidence that you have achieved the necessary learning outcomes, and this is very, very important for your progression as well. So you can get into training programs, you can do revalidation, job applications. Now, when we say revalidation, I'm sure most of you are confused. Revalidation is something that is done only in the NHS, where after 5 years of you being in the NHS, you have to do something called GMC revalidation. That means revalidate that you're still fit to be a doctor. So, collecting your evidence throughout the throughout the 5 years is very important. So it's also very much about learning and reflecting. Each thing that you do for your CV, it's about how much you've grown and how much you've learned from that growth. So you need to think of it as a learning development, career experiences, and a reflection rather than just a tick box activity. Now, coming to the actual CV. Now, any kind of job application. Currently, in the scenario of the NHS, I'm not quite sure about what's happening with the US, but I'm pretty sure it is happening at the same level as well. Currently, in the NHS, one application or one job post has about 200 to 300 applications. Now, when the HR gets flooded with these many applications, the HR is not going to sit down and read through each and every one of them. They're going to maximum spend 30 seconds to 1 minute to scan through each CV. And that's where you have to get their attention. So the next few slides that I'm going to basically show you, it's about how to make your CV a little bit more better and what to add and what not to add. So when crafting your CV, make sure that you look at the job advertisement, the job description, and the person specification for the job. The resume reader will immediately be drawn to your clinical skills and experiences relevant to the job. Now, supposedly you want to get into surgery and you've said, I can do lumbar punctures, I can intubate a patient, I can, put arterial lines. You want to get into surgery, they don't want to look at those skills, isn't it? Yeah, you can do all of that, which is great, which is an addition, but they want to know whether you can actually do surgical things. So you need to make sure that you don't just put anything and everything out there. I can take bloods, I can do femoral line. Okay, is that important for a surgical job? No. You need to say how many cases you've done, how confident are you, how many cases you've done independently, how many cases you've done in observation. Those are the kind of specific things that you need to take. So read the job advertisement, read the description, and read what they want, and only put those in your CV. So you need to make it very concise, very targeted, very clear, and always tailor your CV for every job. Because if you write down, for as I said, for a surgical job, if you write down, oh, I've done a femoral line, I've done, hundreds bloods, they don't want that. They want to know, whether you are fit for this particular job. Always keep things very clear, very easily legible. Now, most of these days is a printed CV, or it's always done on the computer, which is great. But do not use like insane italics or bolds or things. Different kind of fonts that might not be readable. So I'll come to that later on in the don'ts, but this is basically what the do's are. So for the do's of the CV crafting is all of this, including reverse chronological order. Now, what I mean by reverse chronological order is basically not saying that oh, I attended school from this time to this time, then I attended college. No, they want to know what you've done recently, what's your clinical experience recently, and then you go down. So start from what you've done very, now, or what you're doing now, and then go down in your CV. Ideally, I would say keep your CV 1 to 2 pages long, although this is different. It is debatable because a lot of people find 1 to 2 CVs are not in 1 to 2 pages are not enough. But when you're applying for a job which has got about 200 to 300 applications, I think this is more than enough. Just keeping it 1 to 2 pages long, targeted, concise, clear. Keeping it short and sharp will keep the reader more focused. Gaps in your CV to be listed properly with a reason. Many people, they just basically say, oh, I've got a gap. I'm just going to write, I've got a gap and just leave it as that. No, they want to know why you've taken a gap, and do it very, um, truthfully as well. So if you were not well, or if you were going traveling, or if, you were studying for a certain exam, write it down because they understand circumstances. They're not going to basically be, if somebody's like, oh, I've taken 1 year gap, I've not really done anything in that gap. I'm just going to say that, I was working, or I was, just studying. Okay, but do you need 1 year to sit and study? So those are the kind of things that you need to just sit and think about, okay? Now, what to avoid? Now, as I said previously, using very fancy fonts. Now, you need to keep it as simple as possible. Arial, Calibri, and Times New Roman is the professional um, fonts that are used. So always keep it as simple as that. And as I said previously, listing everything that you've done, including passing with 99.9% marks in 10th grade and even 100% in 12th, does not matter, because what they're trying to see is not the fact that how much you've got in school, but how much you've got, you know, after that. If you're an engineer, they want to know how much you've got in your engineering college, or if you're a doctor, how much you've got in med school. So they're not asking you for, you know, list out every day, every year how much you've got. No, they're basically asking you, one, what is overall average of your med school, how much was it? That's it. And even if it's a great thing if you write like, I've got a gold medal in that and this, it's great. Yes, it's not something that is not avoidable. It's definitely something that you should put in there. But putting it there in the start itself might be a little too pushy. So I will tell you when to put it. I've got a structure written out. We can see it at that point of time. Picture. Now, this is a bit debatable. Now, a lot of people say, yes, a picture will be great. A lot of people say a picture is not something that is professional. What I believe, and this is personally my thing, yes, you can put a picture, but please avoid putting like selfies. Like, if you're putting it on your CV and you're just basically you've taken a selfie and you're just like pouting and you're trying to put that picture in your CV, I don't think that's professional. So always use a professional photograph. It doesn't have to be completely professional as well. As long as it's in a professional setting and you look professional rather than you just standing there and be like on your CV, probably will not be the best. Okay. Now, nationality, marital status, what's your age? We've got somebody on unmuted. Right.
Sorry,
So
doctor. Sorry.
continuing, nationality, marital status, age, height, weight, what's your sex, what's your religion, what's your political affiliation. I would avoid. I would avoid. A lot of people even avoid date of birth because what's the point of why would they need a date of birth? I generally do put it, but I wouldn't be like, oh, what's happening kind of thing. So I would generally just avoid your nationality because those are not something that characterizes you on a CV. Okay? Irrelevant hobbies. I feel like a lot of people do this. They basically write hobbies that are quite irrelevant. Some of the hobbies are Netflix and chill. And you're just like, that's not professional, or, you know, that's not something that you need to put on your CV. So keep it very, very, very relevant. You can put in hobbies, and nobody's saying not to. Okay, they're just trying to figure out how you kind of de-stress. And yeah, Netflix and chill is something that you possibly do to de-stress, but maybe make it a little bit more professionalism. Maybe saying that, oh, I like to spend time with my family, or painting, or God knows, do something, but don't just basically say Netflix and chill. Uh, Writing CV on the top of your portfolio. So when you have these one pages long CV and you've written CV and then entire I don't find that great. What rather I would do, supposedly it's my CV, I would basically say Dr. Ashitha Nair, and then my CV goes. So you need to promote yourself. That's what you're doing on a CV. You are promoting yourself, and that's what you got to do. Now, in terms of structure, this is what I would say. Your personal details, and when I mean by personal details, I say your name, your you can write your date of birth, your email ID, and your phone number. Important. Okay. Um, sorry. Then coming into education and qualifications, that's where you write your MBBS degree, what all else other qualifications you have. Yes, you passed out 12th in this year, and yes, you passed out, you know, in this year, school in this year, but again, not something that you need to add completely. Relevant prizes and awards, this is where you will write if you've got any kind of prizes in your med school, if you've got prizes outside of medicine. Again, relevant prizes and awards, relevant is very, very important. You cannot go and write, I won hopscotch or I won three-legged race in my third standard, because they don't care. They do not care. So if it's relevant to the job, please write it down. If it's not relevant, avoid it. Current employment, so that's another one. As I said, you need to start with what you're doing currently and then go with your career employment history. And then comes the part which is optional or which you've done. If you've done any audits, any management experiences, any teaching experience, research, publications, presentations. And last but not the least, reference. Now, reference is not a must, but I would suggest you always put in one reference at least. And the one reference that you put in on your CV should always be somebody that is clinically or currently who is your supervisor or who you're working with. I hope this makes sense. If I'm going too fast, let me know. If I'm going too slow, also let me know. This is basically what I would suggest to take a structure of it. If you guys want to take a picture of this, take a picture, keep it. Again, from the audits to the last bit, it's not, it's an optional kind of view, but if you have it, it'll be great. Now, what I am planning to do is just talk a little bit more on this audits, management, teaching experience, research, and go a little bit deep dive into it just to tell you what exactly you need to kind of think about. Now, the different aspects of the portfolio, as I've said, teaching, research, publications, presentation, audits, leadership, and management, what are these? That is what you guys are possibly wondering, what are these? So I'm just going to talk a little bit more about it. Now, this I've taken for the internal medicine scoring for the 2023 intake. So we had our 2023 intake in August of 2023, and they selected people with this criteria. So depending on how much things you have, you get points accordingly. Now this is basically where I've gone from 2022 to 2023. They've changed things. They've made it a little bit lesser. But this is basically what they look at in your portfolio. So, the undergraduate degrees. Now, in the UK, some people can do a BSc along with their medicine. So that's when they call it as intercalated and they get points for it. Now, 2023, they do not have that. So that's a good thing. And I don't think they're going to bring that back as well. Postgraduate degrees. Now, when we say by postgraduate degrees, I'm not saying by an MD/DNB and things like that. They cannot be claimed. They need to be claimed in certain memberships only. So that's also something that you can get points for. Additional achievements, as I've said, if you've got any kind of gold medals, if you've got any kind of recognition, they have a certain criteria while you apply, which you can look at. Presentations, presentations, publications, teaching experience, training and teaching, quality improvement, leadership and management. Now, I've just put this there for you to understand what they want in IMT or internal medicine training. Now, this is different for everything. Every kind of training that you're going to look into. If you want to go into radiology, it's different. If you want to go into surgery, is different. If you want to go into any other kind of specialty, pediatrics, it's different. But generally and overall these are the kind of domains they look at. So in the domains picture, if you look at the undergraduate, postgraduate degrees, all of that is the general domain that they look at. Let's start off with research and publications. Okay, now when I mean by research and publications, it's very difficult. I felt as a medical student in India, I found it very difficult to be associated with people who are into research and publications, because maybe it was the lack of people that I knew, or maybe it was not very, it wasn't something that people spoke about. It was like, okay, who wants to do that kind of thing? But nowadays I've realized that people have changed. Our med students have changed so much. You have to go out and network out there, and you have to find people who will help you with research and publications. There are multiple types of research and publications out there. There's so many different types of research that you can do. There's so many different types of publications that you do. I'm going to talk about only the two most simple ones so that it gives you an idea. So for IMT, when they say research and publication, they, depending on what your publication is technically, they have points according to that. So you get the highest marks or 8 marks. Now this changes most of the times, it changes every year. They haven't gotten one out for 2024 intake as yet. So I'm still using the 2023 one. Okay, so you get 8 points if you are the first author or joint first author of two or more PubMed cited original research publications. When they mean by original research, that means you have done the entire work. There is nobody else. So that's something that you need to think about. Okay? That's the highest points, but it takes years of research to do any kind of publication like that. And then it reduces. So if you're not the first author, if you're the co-author, you get 1 point less. If you're the co-author of just one or a joint author of just one, you get 1 point less. You've written 50% of a book, you get, it's around 6 points. Again, as a medical student, where would you be have that chance to write a book related to medicine? And they've clearly written, no, you cannot do a self-published book. So it opens your mind into this, reality of things that are there out there that you can do, but feels out of reach. And I want to just tell you that it isn't. You just need to approach that one certain person, and it might take a little bit of time for you to kind of figure out who that person is that is so into research and publications. But as soon as you figure that out, you'll be able associate with them and put in your hard work, and all hard work definitely prospers. So this is a lot I've basically put in here. You guys can take a picture of this if you want to, but it's very easily available on Google. You just have to put self-assessment for IMT on Google, and you should get this lovely website with all of this in there. Now, as I said, I'm just going to talk about the two most important things. You've got a case report, um, and you've got editorials. Now, a case report is a detailed report of the symptoms, signs, diagnosis, treatment, and follow-up of an individual patient. Now, this could be something that you've seen a rare case. If you've seen a rare case that comes to you, you could write it up as a case report and publish it. You still get points for it. You can look up at different case reports on PubMed or any kind of journals, and you'll have an understanding. So associated with, usually consultants get to say this, but I would say if a consultant's happy for your name to be in that case report as well, that's great. So that's one of the easier things to do in publication. The second easy thing is to do is editorials. I have done an editorial where so basically this is an editorial. I've looked at a certain publication that's come out or that's been published, and I looked at it and I basically wrote up, not me per se, but a team of us wrote up this little article as to why we feel we don't agree, or why we feel that this article is not fully developed, basically. All right. So there was an article about how if or is um, bariatric surgery important before liver transplant. So what they're trying to say is, you've got obese patients. Now there is a cutoff for liver transplant. If you are of a certain BMI and above, you are not eligible for a liver transplant. Now, so what they have suggested in that article was we do a bariatric surgery for these people, get their BMI down, and then they can be posted for a liver transplant. They've done their research. They said that, the odds of people dying are very less, and it's a great outcome. But we kind of looked at it and we said maybe not. And when I say that, why is because of the fact that we looked at it and we said if a patient who needs a liver transplant has got their immune system very low regardless, do you want to put them through 2 surgeries and make their lifespan shorter? What is there a guarantee that these people whose immune system, whose coagulation might not be great as well, go through a gastric sleeve or maybe gastric banding? What if they, bleed out on the table, or what if they don't clot enough? So that's what we wrote. We said there is not enough evidence to say that this is correct as yet. And it was published. They liked it and they published it. So it's very difficult to find people who are very happy to do something with you, but persevere and you'll be able to. Now we'll move on to audits. Now, audits are basically quality improvement projects. It's very easy for you to do it in your medical school as well. Okay. Although I have written that doing one in your home country might not be feasible because the concept of an audit is not very prevalent in other countries. But what you're trying to do is you're just trying to compare current practices with the gold standard ones. Um, it can be as simple as VTE prophylaxis, or now what I've written over here is important. Now, I've done a few audits. One of the audits was this one that I've written over here. You have you've you're starting an ACE inhibitor for somebody who's got hypertension, like things like ramipril or enalapril, lisinopril, all the prils basically. So you're starting somebody who's got hypertension, you're starting on this person on this. Now, what if you don't do the renal function test or the urine electrolytes in 2 weeks' time? What are we trying to see over here? We're trying to see if the patient has developed a renal artery stenosis because of starting an ACE. So one of the guidelines is that you have to do a UNE or renal function test after you start an ACE, 2 weeks after you start an ACE inhibitor. This doesn't even just relate to people who've just started one, but it also moves to if you increase the dosage. I did an audit on it and I saw that, 100% was the guideline and we were reaching only about 80% of it. So we were good, but not good enough. So what you've done is you've figured out there is a problem in the system, right? People are not knowing it enough. Maybe people don't know. So you go around, you put leaflets up, you inform people and things like that. And then you re-audit after a couple of months and you see that, from 80% you might have gone to 100% because now people are aware. That is basically a full cycle of an audit. Now, why is an audit important? Because getting involved in an audit can be beneficial for your future applications. Now, I've written foundation and specialty training over here, but it could even relate to even a job application because it kind of gives an idea that you have taken the time to try and improve practices. So it shows your commitment, and it's also an opportunity to network with a lot of senior clinicians out there because you are trying to educate a lot of people. And a lot of people will appreciate you for that idea as well. Okay. It gives you a chance to explore a specialty. It allows you to develop transferable skills. And that just means by communication. You communicate with a lot of people. You get to know a lot of people. That means you enhance your skills. Shows that you're motivated. And an audit is something that you can publish if it's a good enough audit. Basically, you can't just do a small audit and think about the fact that it can be published, but audits are something that you can publish. So just think about that. Okay. This is basically how an audit works. First of all, you need to set your standards. I had a very, very good friend of mine who recently did an audit. I was just like, that's a genius, isn't it? So you do ward rounds. And what he noticed was during ward rounds, where he used to work, there were paper notes. So paper notes meaning like it was actually you had to write down. Now a lot of hospitals still do paper notes rather than electronic notes. So you had to write it down. So what he saw that the word round was extended for a period of time just because people couldn't find these notes. It was kept anywhere and everywhere. So what his aim was to reduce the um, word round by half an hour because he wanted to make sure that the notes people are not running around for the notes. Measure the current practice. This is what we saw that people were running around. Now, what he did was he went in, he bought these, well, not his money, but he approached people and he said, we need to buy these stands where we can put these notes. So supposedly bed 5 to 10 is in one area. We put 5 stands like this so that the notes are in there. And he did that, and that just means that he's reflected, he's planned, and he's implemented a change. He's come back later on and he's looked at it and he's set the standard where the word round has reduced 10 or has reduced by a significant 30 minutes because people can easily find the notes in that set kept area. So do you see how smart some people are about how they do an audit? It doesn't have to be just a certain thing. Okay, so we spoke about the research, publications, and audits. Presentations. Now, once you've carried out your project, now this could be an audit, this could be a research, this could be anything, be sure to present it. Now, going to an academic conference, okay, this can be broadly divided either into poster presentations or oral presentations. That's presenting a poster about your work or speaking to an audience about it. And then it could be national or international. With an international level of conference, usually it's considered more prestigious. At a student stage, any presentation is a huge achievement. Okay, so this can be simple as an audit that you've presented with your team, or a poster at a national level or an international level conference. Now you will be assessed on the number of presentations you give and what kind, and whether it was local, regional, national, international. Most of the times, a local presentation is something that you can do in your hospital. So that's, after you've done an audit, you present it, fine. But take that audit somewhere else. If it's a good audit, take it outside. Make a proper poster with it and go outside and see if that helps. Okay? Most of the poster presentations these days are online because they don't expect you to come. You don't have to do an oral presentation. You just have to submit a poster. If you win, you win. If you don't, you still presented it, isn't it? So that is what you need to think about. That you at least got it and get it in writing that you've actually presented a poster. So that's evidence enough. So presentations was easy. You just need to do a little bit of work to get to the presentation, all right? And maybe give a little bit money to get into the conference. Leadership and management. Now, leadership can be demonstrated in a variety of ways. It must be being president or committee member of a student society while at medical school. Okay, a course representative is good. A representative of a national society is also very good. Basically, anywhere that you've done leadership decisions, that is something that you can put as leadership and management in your CV. Okay, now I've written over here that it should be held for more than 6 months and all of that. That is basically to do with the training portfolio. But if you've done anything of this, any leadership role, people in medicine, you guys have definitely can put it up in your CV saying that you have done leadership and management by kind of providing such a big platform to students and students around the world. This is your leadership and management. Okay. This is again the IMT thing about leadership and management. You guys don't really need to know this, but this is just telling you about how you are graded, okay, and what they mean by a national regional role or what they mean by a local leadership role, okay. Again, guys, please do not include something that you've done in school. It is not countable. All of these needs to be done while you're in med school or while you finished med school. So please don't say that I've held sports captainship in my 12th standard. They're not going to count that. Okay. And last but not the least, we've come to teaching. Now, teaching is very important. Teaching is something that has a huge weightage in points in your IMD or in your training, okay? But it's got really nice outlook if you have teaching in your portfolio, because what they're trying to see is you're not just a student. They want an all-rounder. They want a person who can do anything and everything, somebody who's flexible. So having these bits and pieces in your CV really, really helps. Okay, now what I've kind of written over here, there are two parts for to apply for IMT kind of for your training applications. I'm not going to go too much into it, but what they've kind of said that there are two types: teaching experience and training in teaching. Teaching experience is basically where you have taught people. Now, if you have held a official role where you have taught students regularly, then that's, a certain points that you've get. If you've done informal teaching, that's nothing to be looked down upon. That's still very good, but you might not get as many points for IMT. Okay, and basically, the highest points are if you're able to, design, organize a teaching program, series of sessions, and you've provided teaching for 6 months. Now, this is just basically to do with the port for the training requirements, but if you've got any kind of teaching experience, it's great. The next thing is training and teaching. Now, training and teaching technically means if you've got any kind of postgraduate degrees on teaching, like a PG diploma, PG certificate, or an MSc in medical education, or you've done a dissertation on it. So there are different kinds of diplomas that you can do. That is, again, if you've done it, it's great. It's not an easy diploma to do. It's very difficult, but something that's what you're graded on. If you don't have it, it does not hold, extra value if you don't have it. So don't worry about it. Now these are coming to my one of my last slides. Okay, additional degrees, postgraduate qualifications, commitment to specialty, achievements outside medicine. These four kind of things, again, is additional to your CV. If you have this, it's great. If you don't, it's nothing to be looked down upon or nothing to be upset upon. It's fine. When we mean achievements outside medicine, I don't mean like, as I said, 12th grade, nothing like that. If you've done something like, I number medicine for one thing, is your achievement outside medicine? Because it's not something that you've done in med school, isn't it? It's something that you've done in med school, but it's nothing to related with your med school. So that's one of your achievements outside medicine. There are people who've started like, startup companies outside of medicine. So that's their achievement. So those are the kind of things that you just need to think about whether you can put that in your CV. Just be smart about it. Okay? And these are one of my favorite sayings by Michael Jordan. Never say never, because limits like fears are often just like an illusion. Basically, what I've told you today might, overwhelm you in terms of, oh my God, there's so much to think about, there's so much to do regarding your CV. No, it's very easy things to do. Okay, you just need to be persistent and ambitious on it. That's about it. Okay, that's all, folks.